Antibiotics have had an important role for dealing with infections since their inception. However, due to the excessive use of antibiotics, the bacteria have created an ever-increasing resistance mechanism throughout the years, rendering antibiotics as ineffective. This phenomenon is referred to as antimicrobial resistance, or AMR. It is estimated that if we don't find an alternative for antibiotics, the number of deaths caused by infectious diseases will be 10 million people annually by 2050, which is comparable to the current mortality rate of cancer, and with an estimated cost of 1.1 billion euros. Despite this terrible scenario, there is hope. One possible solution is IgY polyclonal antibodies. But you may wonder, what are IgY antibodies? These antibodies are naturally present in bird fluids, with the advantage over antibiotics of not inducing antimicrobial resistance. To produce these antibodies to be used as biopharmaceuticals for fighting specific infections, hens need to be first immunized with the target antigen or bacteria, activating then their immune system to produce antibodies, which will be then transferred to the egg's yolk. However, it is highly difficult to isolate IgY antibodies from the egg's yolk due to its complexity, rendering IgY as high-cost biopharmaceuticals and not allowing their widespread use. This challenge has been overcome by RYA, that developed a groundbreaking and cost-effective purification platform for IgY. This patented technology has the advantage of providing IgY with high purity level and high yield at low cost. Building on the high purity level achieved, RYA envisions the disruptive application of IgY intravenous administration, which has never been considered up to date. In the long term, RYA's vision is to address the global market for antimicrobial resistant therapies. As we extend our reach, RYA's primary target customers will be healthcare systems. So, how this will be achieved? First, RYA intends to tackle antimicrobial resistance by specifically targeting methicillin-resistant Staphylococcus aureus, or MRSA, which is the second worldwide deadliest bacteria. Secondly, RYA intends to use IgY for intravenous administration, culminating in the use of IgY for treating osteomyelitis, a serious bone infection condition induced by MRSA. Currently, RYA is at the Technology Readiness Level 3 for the first product to treat osteomyelitis. RYA has conducted the in vitro and part of the in vivo studies in rodents. In the coming years, RYA aims to conclude the preclinical studies and the phases 1 and 2 of human clinical trials, after which licensing or co-development agreements with big pharma players will be attempted. To this end, RYA has a motivated team that has been working together for more than 10 years. RYA represents more than just a spin-off. It is sowing the seed to eradicate the next and much more severe pandemics derived from antimicrobial resistance. Trust RYA to foster a healthier and resilient future for all.